Let's move on to our first panel, which is entitled Mental Health, a Campus or Community Challenge. And I'm absolutely delighted to welcome our first panel chair, Katie Tyrrell, to the stage. Katie is a PhD student whose work is researching this area, but Katie's going to introduce herself, so with that I will hand over to you. Welcome, Katie.
Thank you. Hello. Oh, this is a bit daunting. Hi, my name is Katie Tyrrell and I am a research associate at the University of Suffolk. I'm also a current PhD student and I'm looking at how students within higher education use technology within their everyday intimate relationships. I'm also a member of the UKRI-funded Student Mental Health Research Network, also known as SMARTN, led by King's College London. And just a shameless self-promotion here, we've just released a research prioritisation exercise where we're consulting the higher education sector and students and asking them about what are the 3 most important questions around student mental health which they want addressing. So if you have an opportunity to feed into that, that would be fantastic. I'm extremely pleased and very privileged to be here today chairing the panel for you around the topic of mental health, a campus or community challenge. We are all here today because this is a really important topic. We are aware of the rise in young people living with mental ill health and the negative consequences associated with that, but also the increasing number of students who are coming forward to our institutions to report living with a mental health condition. Therefore, as institutions, we need to think about appropriate and effective means of responding and preventative responses as well, sharing ideas and discussing best practice and challenges so we can learn from each other. I struggled with bouts of mental ill health throughout my time at university. I was living with my father, who was suffering with severe depression and anxiety, and was commuting to complete my master's degree at the same time. And for me, it wasn't until a member of academic staff actually approached me and asked if I was okay that I realised that actually I need to go and seek some support for this. And it was that realisation and the encouragement that I needed from that member of staff to actually think this is the time to go and get some help. So I guess what I'm trying to say is that mental health is everyone's responsibility, and we need to ensure that we embed the idea of holistic approaches to mental health across the sector and beyond. So we hope this will be a really open forum for broad discussion around this topic, which really challenges us as a sector to think of ways in which we can improve the welfare, the learning experience, and the everyday lives of the students that we support.